Okay, my name is George Wanamaker. I'm one of the physical therapists here at Presbyterian Village. Um, I am doing the back care and maintenance topic. I did a preliminary presentation last week on the anatomy of the back, and what I want to do today is build upon what I talked about last week and continue on to talk about some of the stuff that can go wrong, whether it's through age, diet, changes the lifestyle, that kind of thing, as far as the back to build upon. And then in the next session, next Friday, I'd like to continue on that, talking about some changes and lifestyle changes, body mechanics, that sort of thing. So all of this is going to build upon each other. So what I'd like to do first, though, is review what I talked about last week as far as the general anatomy of the back. So I'm going to do my best to draw a picture, if this will stay up. So the back essentially is four parts, but we really only talk about three functional parts of the back. There's the neck, which is the cervical, which has a concave curve. So I'm going to draw, this is the head. The cervical, the neck part, has a concave curve. So normally it curves in like that. The next functional part is the chest area, the thoracic, which has a convex curve. And then you come to the lower part of the back, which is where most people have problems, is the lumbar spine, which again has a small concave curve. So I'm trying to illustrate that, and I'm going to use a red pen this time to highlight. So this is a concave curve, the cervical, the neck spine, and then the lumbar is another concave curve. So typically in an adult male, either the cervical or the lumbar are the regions that have problems. So again, cervical, thoracic, which is the middle section. Oops, sorry. There we go. Cervical, which is the neck. The thoracic is the middle part of the back, the trunk area, and then the lumbar spine is the lower part. So that's just a general review of the curves in the back. So let me erase this. This is all stuff that we talked about during last week, so I don't want to spend a lot of time on it, but I do want to just review. So what I'm going to draw now is the general structure of the actual segments of the spine. So the spine is made up of the vertebra, which are the bones, and then the discs in between. So these are like bricks. So those are your vertebrae. They're stacked on top of each other. And then you've got your discs, which is like the mortar in between. And a sky view of that would be something like this. You've got your big vertebra, which is the bone, and then you've got little bony outcrops where muscles attach. What you also have here, and I didn't do a good job last week of drawing, you have your spinal cord, which goes down throughout your body from your brain in between. Now, I really want to highlight this today because when we talk about stuff that can go wrong, this spinal cord is important because that's where all your nerves travel down. So it's like a little tube within a tube. Also, you've got, coming out through the sides here, you've got nerves that branch off of this central cord. So in between these bricks is the disc. And the disc has two parts. Again, this is review from last week. It has a tough outer fibrous section, and it's got a gel-like substance in the middle. This gel-like substance is called the nucleus, and then the outer structure is called the annulus. So this structure of the disc and the structure and the orientation of the spinal cord is what is going to be important during today's talk. So give that a sec to sink in. The vertebrae are stacked on each other. There's a certain amount of space naturally between the disc that's sandwiched in between that holds everything upright. And then the sky view of this, you have nerves coming out the side, and there's a central spinal cord in between. Okay, so let's talk about some stuff that can go wrong over time. And bear with me, my whiteboard doesn't erase very well, so I'm going to have to kind of compound on top of what I've already drawn. I need some spray, but I don't have any. Okay, let's go back to the curves. So normally, we talked about 3 main curves, 2 concave curves and 1 convex curve. So you've got your head, your cervical spine, which is a concave curve. Then you've got your thoracic spine, which is a convex curve. And then you've got your lumbar spine, which is again a concave curve. So I'm trying to highlight, this is like an S shape, roughly. What can happen with age, with different lifestyle changes, with diet, is over time, as you probably noticed, people tend to become more flexed in their posture. And a lot of that has to do with the actual curvature of the spine. You can develop what's called kyphosis. Let me spell that. K-Y-P-H-O-S-I-S. Kyphosis. And what essentially that means is your curves in certain areas are flattening out and in certain areas are exaggerated. This can be due to just the lifetime of gravity impacting the spine, but it can also be because of mineral changes. Your spine isn't as dense as it used to be, or you've had an injury which can change the structure. So where we typically see kyphosis is more in the trunk area, this middle area, where you end up flexing more. So essentially this middle area here, let me highlight it with the red. So this middle area here, the thoracic spine, is where we normally see the kyphosis. So instead of a nice gentle curve, you might have a more exaggerated curve. Okay. Can you still hear me? I'm adjusting the mic a little bit. Sorry. So instead of a gentle curve, as you might have in a young, healthy adult, over time, this curve can exaggerate, leading to something more like rounded curve. I'm trying to exaggerate the degree of this curve here. What can also happen is the lumbar, the lower area curve, can flatten out. So instead of being a nice S-shaped curve, it could be more of a hook-shaped curve. There's a couple reasons for that, but that's called kyphosis. It's when the trunk is more flexed and pronounced because of the curve of the spine changing. So let's erase all this. All right, kyphosis. And we may not get through everything I want to talk about today. Sorry, I'm just trying to reposition the mic so you can hear me well. But we'll get through most of it. Okay, another thing that can happen is something called scoliosis. So scoliosis, if you've ever noticed somebody tilts a little bit one way to the left or the right, it may be due to a spinal change. This tends to happen more in females than males, and there's some hormonal reasons for that. Normally, your axial skeleton, axial meaning it's through like an axis, is generally straight up and down. You've got your head on top, and you've got your pelvis here, but generally there's a pretty midline alignment of gravity straight down through. What can happen through hormonal changes and degenerative changes is there's more of a curve. I'm going to draw the pelvis here. There can be more of an S-shaped curve to the axial spine, meaning straight up and down. That's called scoliosis. Sorry, my handwriting is terrible, but scoliosis. So that's what that is. It's just similarly to the forward structure of the spine, bending forward, it can have side-to-side changes. This is important because as we go back to the nerves coming out through either side of the spine, like how I drew it earlier where the nerves come out. I'm sorry, this is compounding on each other. If you've got pressure on one side versus the other, it can put pressure on some of these nerves, leading to some pain. That can be all the way up and down the spine, not just in the low back. That's scoliosis. All right, let me erase all this. I'm trying to talk loud, so I know having the masks makes it a little bit hard, but I'm trying to exaggerate. All right. So another thing that can happen is something called a degenerative disc. Hold on just a second. Okay. Degenerative disc. So we'll go back to the side structure of the spine. It's the bricks on top of each other with the discs in between. Okay, so in a normal, young, healthy adult, there's a certain amount of space in between these bony vertebrae and the discs. These discs have a normal pressure because of the fluid that's in it that holds the spine up. Through aging, life processes, hormones, that sort of thing, these discs can degenerate and they can shrink. So what can happen is something more like this, where, and I'm not doing a good job of drawing this, but these discs can shrink so that the space in between the discs is less. That's important because if you think back to what we talked about as far as the anatomy of the spine with the nerves coming out, there's a certain amount of space in between these discs for nerves to have enough space to travel. But if there's not that space there, it can put pressure on these nerves coming out, so they don't have as much area that they used to. I'm talking about right here, which can put pressure on those nerves, leading to pain. So if you ever hear somebody that has degenerative disc disease, this is what we're talking about, is the disc structure in between the vertebrae changes. What can also happen is through aging, through use, through hormonal changes, I keep coming back to that because that's generally what triggers it, is these vertebrae can change their structure through stress and have more jagged, bony edges, which can also put pressure on some of these nerves and the discs. So I want to draw the top structure of the disc again. So normally there's the annulus, which is the outer structure, and then there's the inner structure with the nucleus. This annulus is normally pretty rigid. It's firm because it holds all this structure in. But what can happen is through gravity and stuff, think about a water balloon. A water balloon, if you squeeze one side, the fluid goes to the other side. And the same thing can happen with gravity over time and through repetitive use, is as you're bending up and down, it puts pressure on the front of that disc, and the fluid inside can go farther backwards. Over time, that can cause little cracks and fraying in this tough annulus, which can cause this structure to be weakened, which can lead to bulging of this inner structure, which then can lead to bulging of the outer structure. So I'm trying to highlight. So it's the same thing as a water balloon. You squeeze one side, the fluid doesn't have anywhere to go, so it goes to the opposite side. So again, that can put pressure on some of these nerves coming out, leading to pain. And it can also lead to not only pain, but changes with function, with the motor function. All right, let me erase all this. You can also have other arthritic changes, meaning arthritis, to the spine structure itself. If we go back to the sky view of the vertebra, it's like that. These are just places where muscles attach. You've got your disc in between, you've got your spinal cord. What I haven't drawn yet is little outcroppings. When these discs and when these vertebrae are stacked on top of each other, to have good spinal movement, they slide on one another. Normally there's cartilage in these areas right here where they're stacked, which allows for good fluid movement, side-to-side movement and forward and backwards movement. What can happen is over time this cartilage can wither, break away, which can lead to a lot of pain and a lot of rigidity as you're moving through your body's mechanics. So that's another arthritic change, not only to the vertebra itself, but the perches that each one stacks on top of each other. That's usually a pretty painful problem. Okay. Erase this. Check my time here real fast. Okay, so we talked about a little bit about when the nerve root, the root coming out the side, gets compressed. So I don't want to spend a lot of time on that. There's something that is common when you have all these structural changes to the spine is something called sciatica. And to talk about sciatica, we really need to go back to the structure of the spinal cord, the nervous system structure itself. So you've got your brain, you've got your spinal cord coming down from your brain, and for the sake of time, we'll talk about the lower section. You've got nerve roots that come out of your spinal cord, and they do a thing called a plexus, where they all come and meet together. If you imagine a telephone wire's got a bunch of different cords and a bunch of different wires wrapped up in a sealed tube. It's essentially the same thing. It is these different wires from different addresses come together and they form a pretty thick, it's roughly the size of the erase pen. It's a good thick structure. But that goes down the back of your leg. So this is not necessarily a back problem, but it can lead to back pain. So you've got your pelvis here, and attaching to your pelvis is a bunch of muscles. So I'm trying to cover up all this nervous tissue with muscles. What can happen is that if those muscles are tight or if there's a structural change to the spine, those muscles can put pressure on this nerve, this big nerve coming out, essentially short-circuiting it. So it's not getting a good signal from your muscles in your leg that sends up, but it's also not getting a good signal from your brain sending a signal back down. So it's a two-way street there. What happens is, typically, this is a simplified version, but we think of these muscles in the back of the hip and the low back right here. That's a red pen, so I'm trying to highlight it. They get tight or they get compressed of some sort, which leads to compression of that nerve. And what can happen is lower downstream, down here in the back of the leg, or even down into the feet, if it's severe enough, it can get compressed and cause tingling, pain, sharp pain, can cause motor function issues, even trouble lifting a leg. And that's typically grouped in a category called sciatica. Sorry, my handwriting is terrible. Oh, sciatica. So that's, if you've ever heard of sciatica, that's essentially what's going on, is these nerves in the low back coming out are getting compressed either by bone, musculature. Commonly it's musculature, but it can be a bone if it's serious enough. And farther downstream, down in the leg, is where you really feel the symptoms. Again, this is a very simplified version of what's going on. But a common early sign of that is numbness, tingling, or something in the lower leg, and low back, hip associated pain. Let's go back to our disc. Our disc, we talked about, had the annulus and the nucleus in between. And we talked about in bulging discs and that sort of thing, this fibrous outer structure can become frayed and brittle. What can happen if it's bad enough and there's enough trauma or enough of repetitive force causing this to fray is you can actually have what's called a herniated disc, where this nucleus can actually really bulge out into the associated spine and nervous structures. There's different classifications and degrees of this, but for the sake of this lecture, essentially a herniated disc is this inner material can't be contained anymore, so it travels the path of least resistance. I should use a black pen for this. And it goes to where there's a fray or there's a damage here, and it goes whatever path that it can travel, the path of least resistance. And that's essentially because that annulus structure has frayed enough to where it can't contain the inner nucleus gel structure. That's what's called a herniated disc. And again, there's different degrees of that, but I'm just trying to exaggerate the thought process behind that. Herniated disc. Okay. There's two more things I want to talk about. So we'll go back to our vertebra structure. So that's the main core of the vertebra. You've got your spinal cord here, and then you've got the bony structure that comes out. Ooh, that's bad. So the spinal cord, as we said, goes from the brain all the way down to roughly your low back. It's a tube within a tube. What can happen if it's really bad, if the arthritis and the structural changes are really bad, it can lead to what's called spinal stenosis. I'll write that in a minute, but here, how about this? Stenosis. And essentially what that means is it's a narrowing of the spinal cord because of structural changes. There's different types, but essentially this bone has, for whatever reason, encroached on this spinal cord in the middle, causing a narrowing of the cord, which is putting pressure to those nerves coming down through the body, through the spinal cord. It's usually common in the low back. But it can occur up here, really anywhere. It just depends on the person. But essentially, this cord is getting encroached on, and there's not as much room for it to freely send the signal up and down. Again, this is a telephone wire analogy. A bunch of wires coming together to a central insulated core. But if somewhere structurally, like a tree or something, has landed on the cord and is stuck there, you're not getting a good signal up and down. That's spinal stenosis. There's one more thing I want to talk about for the sake of this lecture, and that'll generally cover our pathologies of the spine. Because next week I want to talk about treatments, stuff you can do at home to help preserve your spinal health, as well as proper body mechanics. So one more thing I want to talk about is something called ankylosing spondylitis. Ankylosing, that's supposed to be in. That's ankylosing spondylitis. And essentially what that is you've got your bricks, and you've got your disc, your mortar in between. This is more common in it presents normally in younger males, ankylosing spondylitis. So what happens is normally you've got your good space in between your bricks, but through structural changes, through gravity, through a bunch of hormonal changes, you can have your bricks tilted a little bit, and what can actually happen is on the front structure of the bricks, the bone can actually fuse together if it's severe enough. But that leads to a change in mobility, so you're essentially stuck in this flexed posturing because your bones don't have the mobility anymore because they're cemented together. That is very, very painful. There are treatments. There's treatments for it medically, as far as different medicine, different braces, physical therapy, that sort of thing. But it's a very painful condition of the spine itself. And again, this is more common in younger males. That's when it normally presents, but it can have full life cycle changes. All right, so that'll about cover all the pathologies I want to talk about today. Pathologies meaning stuff that can go wrong with the spine. Again, next week I want to talk about some home treatments, awareness to the back, and proper body mechanics to preserve and improve spinal health. Again, my name is George Wanamaker. I'm one of the physical therapists at Presbyterian Village Austell. And this is the general multi-week talk about spinal health, spinal maintenance, that sort of thing. To just give a general understanding of the back, the structure of the back, what can go wrong, and some home treatments. So thank you. It's been a pleasure.